Hi there, welcome to week 3 of Epidemiology of Substance Use Disorders. And today we're going to talk about sources of information, and in particular, how we can get our hands on useful information that for the most part has already been collected. And that information can be used for standard epidemiological purposes, like describing the distribution and determinants of substance use disorders. It can also be used for analytic observational studies, like testing hypotheses and theories. But we also want to make sure that we're dealing with data that is reliable and valid. So we're going to be talking about how you establish the integrity of the data that you're using. Let's start with looking at the ready-made sources of information for epidemiological data. And the internet search engines can provide access to very useful sources of information at the local, national, and international level. At the international level, the World Health Organization has a remarkable set of data sets that are connected with the global burden of disease study that we'll be talking about, as well as international surveys that have been conducted by psychiatric epidemiologists, including people specializing in substance use disorders. The Pan American Health Organization, which is a subsidiary of WHO, also has a website that provides easy access to survey data. And they've got remarkable studies of gender issues in different countries, as well as emergency room admissions and population surveys. The United Nations Office on Drugs and Crime, UNODC, has catalogs and atlases that they publish that describe the distribution of substance abuse and substance abuse indicators around the world. Within the United States, SAMHSA, the Substance Abuse and Mental Health Services Administration, has data from national surveys as well as reporting monitoring centers that report in the overdose deaths and other indicators of drug use and drug problems. Similarly, in Europe, the EMCDDA, the European Monitoring Center for Drugs and Drug Addiction, has a great website that provides access not only to summary data, but also in some cases raw data. And there are other sources that you can find by going through the sources provided for this course. You should also check with the Yukon Library and their website to find out what books are available, journals, electronic media, and other things that can be accessed through the library. And finally, there's what is called the gray literature. The gray literature is government reports and newspaper articles and foundation studies that often are not published in peer-reviewed journals or in books, but these reports often have remarkable types of information that are collected on specific topics. And you can see them cited in other sources, or you can hear about them through newspaper articles or go to the sources themselves for organizations like the National Academy of Sciences. So let's get started with a discussion of epidemiological assessment using social indicators. Social indicators are a key tool that is used to study substance use disorders, often in terms of observational studies, descriptive epidemiology. And we can learn about the types of drugs that are being used, the types of problems that are being experienced by people in the population, and sometimes we can even break it down by demographic variables like sex or socioeconomic status, education level, or age. These types of social indicators can facilitate not only descriptive epidemiology, but also public health surveillance. We can monitor trends over time. What we want to do with this data is often to study the distribution of substance use disorders and their trends over time. We want to monitor the course of an epidemic, like the use of opioids, pain medications, and how the pain medications are leading to overdose deaths. We want to project future trends depending on whether the course of the epidemic is rising or falling. And we want to estimate public health impact. All of these things can be done by using social indicators to conduct public health surveillance. Where do we get this information from? Well, we can start with the existing literature and documentation. As I mentioned, ready sources from these government agencies, these international agencies, and from local and state organizations. And we can look at the existing literature which has published the summary data for this. So if we want to get our hands on a particular issue that is becoming more and more acute in terms of the need to do epidemiological investigation, a good place to start is with the existing literature and documentation. Another place is to go to these organizations for routine statistics. What's happening, for example, with overdose deaths or babies being born with opioid addiction. These sources of data can be obtained from routine statistics. Qualitative information sometimes can be obtained by talking to alcohol and drug users and collecting the qualitative reports that come from the police department and other organizations which are on the front lines. Emergency room physicians are often a good source of data about what drugs are being used. And finally, once you've gotten a handle on what is being revealed in these social indicator data, we begin then to be in a good position to design an epidemiological survey. Routine statistics in particular are important ways of studying the initial stages of an epidemic. Hospital discharge diagnoses, treatment admissions, police arrests for alcohol and drug offenses, seizures of illicit drugs, court convictions for alcohol and drug offenses, and drunk driving, mortality statistics, infectious disease notifications like hepatitis and HIV, and reported cases of AIDS itself. So these kinds of routine statistics are often collected and published by government agencies, and we can look at them in a cross-sectional way, or we can look at them in a longitudinal way. These kinds of data eventually can be used to plan health and social services for people with alcohol and drug problems. So once we learn about the extent and nature of the use of a particular substance and what consequences are associated with it, we're in a position to see whether the existing services are going to be adequate, and if there's a suggestion that an epidemic is emerging, as it is with the opioid epidemic in the United States, it's the epidemiological data that make it possible for us to go to the government organizations, the Congress in particular, to appropriate money to begin funding treatment and prevention programs. We also want to know about risk behaviors, whether people are injecting the drugs or not, whether they're sharing needles, whether the alcohol products are particularly dangerous, like the production of energy drinks or high alcohol content beverages that are being misused by a particular segment of the population. All of this information can be used to factor in to the planning of health and social services when we're in a position to monitor the social indicators. We can also look at the patterns of help seeking that are going on within existing services. Are people with problems turning up at our existing treatment services? Where are they going? Are they going to mental health, the emergency department, their primary care physicians, or are they going to treatment settings? And we want to look at the profiles, the demographic profiles of the people who are affected, their gender, their age, their socioeconomic status, ethnic differences. Finally, we want to find out what the treatment needs are and whether those needs are being met. Social indicators can play a valuable role in pulling together data that can help us to plan services. With that, it's time to point out what the limitations are with these types of indicators. They're not perfect, they're often collected for other reasons, and their reliability is sometimes suspect. So what we want to do is often in our epidemiological research, if we're doing research, we want to get a variety of different sources of data. We want to get self-report data, we want to get social indicators, and we want to put them together to see if they tell a coherent story. What may be strong data in one area is going to compensate for weak data in another area. For social indicator data, if it's being collected from a variety of different sources, let's say at the state level in 50 states, they may have different ways of collecting the data, like drunk driving statistics or mortality statistics. And each state may do it somewhat differently. We've got to test the consistency of the data to make sure that it's being collected in a way that's useful. The accuracy or validity of the data is also important. If it's incomplete, we may have biased samples. The missing data may be leaving out an important segment of the population, such as people who are homeless. The data may be inaccurate, that they're being coded improperly, or the people who are recording it on death certificates are, for example, biased in favor of protecting the family from stigma. If it's a suicide overdose deaths, it may not be coded as a drug-related suicide. It may be coded as death from an accident or from some other type of less stigmatizing cause of death. So all of these things need to be taken into account in evaluating whether our social indicator data are going to be useful.